And so can you tell our listeners just a little bit about why you wanted to run for office?
Yeah, sure. My big focus is drug policy, and I take a look around the province, and we're experiencing a horrible public health crisis. We're actually involved in two public health crises. So, of course, we have the COVID crisis, but we also have an overdose crisis that's been going on for now about 5 years, attributable to a poisoned drug supply. I looked at the response of the government in dealing with the overdose crisis, and I really find it lacking. And I think there's a lot of things that we can do that would just be better interventions and help save lives and manage the overdose crisis better. So that was my largest motivation to run right now, is to raise awareness of drug policy issues and what we can do for them. Of course, I'm also interested in progressive change in other areas around things like climate change and building a sustainable economy and social services as well, which I'm also really, eager to bring awareness to those issues.
So yeah, you're running in the riding of Vancouver-Kingsway, and your BC NDP competitor is Adrian Dix, and he's been the health minister for the past 3 years. What are your thoughts on how Dix and his ministry have approached the overdose crisis?
My take on Adrian Dix is that he's largely been absent from conversations and approaches to the overdose crisis. And so when the NDP government came into power 3.5 years ago, they created a brand new ministry, the Ministry of Mental Health and Addictions, which was responsible for coordinating and organizing approaches to mental health, but also addiction and the overdose crisis. And so I think even though the health ministry funds things like treatment, harm reduction services, Adrian Dix has not been a very vocal supporter of dealing with the overdose crisis. He's been largely absent from conversations, and a lot of these things have been left with the Ministry of Mental Health and Addictions, which is actually the ministry that has the lowest funding. They receive about $10 million a year, which is even less than the funding for the Premier's office. And so I think the ministry has been underfunded. Minister Judy Darcy is trying very hard to do things, but she just doesn't have the political power in the cabinet as other ministers do, including Adrian Dix. And I think, to me, if the overdose crisis was as urgent and important as we know it is, and as the government says it is, the approach would be much different than we see today. We'd see full engagement of the Minister of Health, as well as also the ministers responsible for criminal justice in the province, the Solicitor General and the Attorney General. And we'd see, approaches like decriminalization being fast-tracked, not kicked to Ottawa for, delay.
And, what are some approaches that you believe are very important for addressing the overdose crisis that Adrian Dix hasn't as much as you'd like to see?
Yeah, so absolutely. So one of the first things we should be doing is decriminalizing simple possession of drugs. And so this is an idea. It's not a novel idea. It happens in other jurisdictions around the world, most notably in Portugal, which decriminalized all drugs in 2001. And there were really positive effects of that. They didn't see big increases in drug use. They actually saw harms of drug use decrease. They got people into care and services when they need it. And so I think we need to be urgently, particularly around COVID, because COVID made the overdose crisis worse. Because of COVID, we need to urgently decriminalize now. And so Dr. Bonnie Henry, who's the hero of COVID response, and we'll follow her off a cliff doing the things she says we should be doing for COVID, actually released a report in 2019 that called on the province to decriminalize, and it called on the province to do that unilaterally with amendments to the Police Act or other things that would change how drug crimes are enforced, and so basically reduce police enforcement of drug possession. That was ignored. That report was just kiboshed immediately by the government that said we're not going to do that, and we've sort of been in this stasis now for over a year, where we have the situation where Premier Horgan says, I really want to decriminalize, but then says it's not my responsibility to do it, it's Ottawa's. And Ottawa says, the Prime Minister says, no, we're not going to decriminalize, so we're stuck. And I think what we need to do is we need to figure out how to decriminalize as soon as possible. And what decriminalization does is it's important because it allows us to really treat substance use as a health issue where people have problematic relationship to substances. It reduces stigma, and stigma and discrimination create really terrible barriers to accessing things like treatment or safe supply or other medical services that people who use drugs need. And so decriminalization would help. There's really no downside to it. We should be doing it immediately, and we shouldn't be imposing things like new fines or forced treatment or drug courts on people. It just should be a stand down of the police. So that's the first thing I think we should do. The second thing I think we should do is we have a program of safe supply. We've now as a province created the ability for registered nurses to prescribe safe supply. And so safe supply is basically just pharmaceutical alternatives to drugs that people are purchasing through the unregulated market, and which could be tainted with all kinds of chemicals and poisons and powerful opioids and different things that people aren't looking for. And so a pharmaceutical alternative is safer because people know what they're getting. They know the potency of it, and they're getting it through a doctor and a pharmacist. And so we have programs of safe supply in place now, but not nearly up to scale of what it needs to be. And so we need to be listening to drug users as consumers to find out what drugs they want to receive through safe supply. We should figure out how we provide them with those drugs in a safe and responsible way, and ultimately make sure that it's accessible to anybody who needs it across the province, whether you live in Vancouver, downtown East Side, or whether you live in a rural community up in northern BC. You should be able to access a safe supply of drugs when you need it. And then the third thing I would suggest to respond to the overdose crisis is we really need to be thinking about harm reduction again and scaling it up. And so we need supervised consumption services. We need naloxone. We need needle syringe programs. All of these things need to be at scale across the province and operating at a level that is accessible to people who use drugs. And so what happened with COVID was a lot of these services that had been in place and were saving lives ended up getting shut down, and people were told to stay home. And what we've seen now is a dramatic increase in overdose deaths in the province. And so for the last 4 months, we've had record-setting number of deaths, the highest number of deaths we've ever had.
Something I did want to ask about earlier was the topic of safe supply, because I know that the government did introduce a safe supply program back in March, just in light of the pandemic and all. And of course, there was Bonnie Henry's recent announcement that nurses could prescribe non-tainted drugs as well. But as you were saying earlier, it's kind of on more of a small scale. How do you propose that the government should approach the issue of safe supply differently?
Largely what has happened is we're in a context where doctors were told, after a period of overprescribing of opioids, which that situation was never as bad in Canada as it was in the U.S., but it was part of the reason that people now have dependence on opioids in a high number is opioids for a period were overprescribed, and so doctors were very sternly told, don't do this, don't prescribe opioids unless absolutely necessary and in certain conditions. And so safe supply is now a big reversal of that, and physicians and pharmacists are quite wary of of doing this. And so I think, and then the other factor that plays into it is this stigma and discrimination against drug users generally, where often physicians or pharmacists look down upon drug users and don't really treat them medically as the way they should be. And so I think, what happens, what we could be doing is instead of leaving it as a sort of a voluntary program where physicians can, decide to prescribe safe supply or not, and many are choosing not to, the province can actually take a more proactive role in directing the colleges of physicians and pharmacists to mandate that doctors take part in this program. Like, they need to be trained, they need to deliver it, and they have to do it. If somebody shows up in your office and says, I want to get a safe supply of opioids or benzodiazepines or stimulants, the doctor shouldn't say, no, I'm not doing that. They should say, okay, I'll help you. And that's, it's sort of the situation if you went into your doctor and said, I have a skin rash, can you please prescribe something? And the doctor's saying, no, I'd rather not. I think that we'd find that offensive and unacceptable in other situations, and we should find it the same way when a person is going to a doctor and seeking medical care. We can't allow them to be turned away because of stigma or discrimination, or just a doctor that just doesn't want to get involved in this program.
And kind of moving on to one of the big other planks that you were talking about there with decriminalization, the BC NDP did release their platform a few days ago, and they did make a commitment to establish decriminalization, like either federally or what their words were made in BC option. Are you kind of skeptical about that promise, or because it kind of seems like something that you're talking about as well, because they're saying that they do want to decriminalize provincially, but what are your kind of thoughts on that promise?
I find their language to be quite vague and wishy-washy, and more of business as usual, because nothing particularly has changed from other things they've said about decriminalization. So again, Premier Horgan said, yes, I'd like to decriminalize. It's not our jurisdiction to do it, so we're going to go, talk to Ottawa about it. And so basically there are different mechanisms where the province can decriminalize. So the first one is we can ask the Minister of Health in Ottawa to issue an exemption for the whole province to the Controlled Drugs and Substances Act. And so that's the first thing we should be doing. We have indications that the Minister of Health would do that in Ottawa. They would be open to doing that for a province. And so we should be strongly advocating that the federal government issues one of these exemptions. And at the same time, what we should be doing is the thing that the BC government said they weren't interested in doing, which is implementing Dr. Henry's recommendations about amending the Police Act. And so that's something that we could do in BC. And basically what it says is that we are deprioritizing enforcement of simple drug possession. And so you as a police department cannot spend resources, human or monetary resources, on enforcement. And so those are two things we could do. Those are, I think those are very specific answers, as opposed to the NDP's sort of, we're talking to Ottawa about something, which could also mean we're just waiting for Ottawa to come out in favor of decriminalization for the whole country. It doesn't, and then a made in BC solution. I'm just not sure what that means. We have specific mechanisms. There's no reason to be vague at this point, and so I think we shouldn't be. And so I think, again, I want to reiterate, there's a lot of discussion of or fear, we can't decriminalize because chaos, and we must put in place all kinds of services and things before we can decriminalize. And so what we know is that criminalizing people who use drugs, it just makes their life worse. It makes the situation worse. It harms public health, harms human rights. There is no benefit. We know it doesn't work. It doesn't reduce anybody's drug use or the availability of drugs. And so I think a simple thing we should do is just stand down. The police, we should stop criminalizing people Now, if we do that, we'll save a lot of money. We'll save policing costs. We'll save criminal justice costs through the court system. And we can choose as a society how to spend that money. We could say we'd like to put more treatment options available. We'd like to scale up harm reduction. We'd like to scale up education and prevention. Like, all of these things are on the table, but decriminalization shouldn't be held hostage to us putting in some program first, because people's lives are suffering and people are dying, and so we need urgent action quickly.
The BC Liberals have also been very critical of the NDP's approach to the overdose crisis, but they've mostly kind of stressed talking about like recovery and prevention as kind of something that they really want to see expanded. Kind of what are your thoughts to that approach of the issue, just like really emphasizing things like recovery?
Well, I think recovery is fine. It's, I believe, first of all, recovery is sort of a vague term in itself. And often what people mean when they say recovery is abstinence. And recovery is actually much more complex than that. And I think, recovery is actually a very personal term where, you may get to a point where, like, I'm continuing to use drugs, but it's not affecting my life in such a harmful way anymore, and that's recovery. Or it could be that I am abstinent, or it could be that I'm in some other situation. But it's a very personally defined term that I think it sort of necessitates a bit more clarity. But I feel like people when people decide I no longer want to take drugs, or I want to reduce my drug use, that's great. And I fully support that. And I think that person, when they're ready and able, should have a program of treatment in place that they can access. But the challenge is, though, that often people are not at that space. We hope they will be someday, but we're not going to let them die in the meantime. And so that means that we really need to focus on harm reduction. And so it's harm reduction around policy, which is decriminalization, but it's also harm reduction around just providing them safe spaces to use drugs where they won't overdose, or if they do have an overdose incident, it gets reversed through oxygen or through naloxone. And so that's a supervised consumption site or an overdose prevention site. And so I think, treatment is fine. It's one pillar that we should be thinking about. There are other pillars of addressing the overdose crisis that have often, not been put in up to scale, and have not been treated the same. And so I think, we should have all options on the table. We need a very as broad of a toolbox as possible to address the overdose crisis.
And yeah, that's all I got. Thank you so much for this. Talk to you later.
Okay.
Bye.
Take care. Bye.
Take care.